And again, in the program that you'll get tonight, once I send it through, there's a little goal section. And I make a good point in there. Just think of your physical goals, objective goals. Not to not have pain, while that is almost like a side effect of what we're aiming for. Think of the things that you'd like to be able to do with your body. And it can be simple things like we had a lady who just wanted to be able to walk around the shops without having to sit down at every kind of chair she had available to her in the shops. So that was her goal that we've worked towards. For other people, it's I want to lift X amount of weight on a squat or a deadlift or something like that. But if you think of kind of those objective goals, both short-term and long-term, you might just think playing Transformers for X amount of time without pain, but then long-term might be I want to be able to run 10K, whatever it is. But thinking of those objective goals is it helps you stay on path with this kind of stuff, because pain, I'm going to repeat myself now, I'm jumping into the presentation now, but pain will fluctuate. And if we're measuring our improvement just by pain, it's a bit of a tough one, because ultimately, good days, you're going to have bad days. But if you measure your improvements through more objective, functional-based things, you'll see this nice up and to the right progression, and that's much more optimistic through the process there as well. So now that I've ticked off probably a slide already, we're going to jump right into it. A bit about us. So obviously some people here are patients or have been patients, some are new faces. We are Scope Sports Injury and Exercise Clinic. So I'm the owner. My name's Dan. I'm a sports chiro, strength and conditioning coach. Had a lot of chronic pain about 8 to 10 years ago now, but it was something that's really kind of shaped our approach to how we care for people and kind of the services and things that we do for people, in particular with kind of chronic, recurrent kind of issues. And our approach to things, which we'll talk about shortly, is really helping people like yourself who is becoming impactful. You've probably seen multiple practitioners, you've probably had injections and scans and the whole thing, and still kind of find yourself in roughly the same situation. And so that's kind of who we help the most, basically. And so they're hanging out in the corner over there, but Lou and Ange, if you want to come forward, you certainly can. So they're excellent coaches who you're going to spend a lot of time with today, really know their stuff, and are just brilliant. So they are part of the team, obviously, and we work with people mainly in the gym environment to help them build strength and find confidence in themselves, basically. So yeah, you'll get to know them very well. They're not the quietest of two. A compliment. All right, so our mission here is to help people overcome their pain, rebuild their body, and return to a life without pain limitations so they can focus on their health and their well-being for the long term. So really for us, something we say quite often is, what we try to help people with has a greater purpose. It's not just pain in the moment. It is that you can get back to being kind of the father you want to be or the mother you want to be. It is so that you can be the athlete you want to be. It is that you can help people that you want to be helping. For us, this is kind of the purpose there. So we ultimately, whenever we speak and engage with people, we want to know who they are, engage with them, understand them, their situations, what they do for work, of course, their family, their goals, all that kind of stuff, to make sure that we're pushing them in that direction and helping them in line with with that kind of mission. So this is kind of the roadmap that we're going to work through today. We're going to start with a little bit of stuff around pain, about back pain. We're going to talk a little bit about what that kind of principles of rehab are. We're going to talk a little bit about the impact of sleep or lack of sleep and stress management on pain. So the roadmap today, so we're going to start with the pain, sleep, stress management side of things. We're going to talk a bit about common back myths and misconceptions, because that often is one of the things that can hold people back a little bit, is if they've been told the wrong things, or these kind of things impact our behaviors, and those behaviors aren't helping our resolution on these things. So we're going to kind of maybe break a few beliefs some people might have. So we're going to kind of open that up to a bit of discussion in just a second, and we're going to kind of go through all of that. We're then going to go into breath work and what we call a body scan. And so we'll go into the depths of why we do that, but we're going to teach you how to diaphragmatically breathe, and then just checking in on the body, because we're going to use those principles along the way through the mobility work that we're going to do, and the activation work and the strength work. We're then going to go into spinal control, mobilization, and self-massage, show you how to do some of the really kind of key exercises there. We're going to run through gluten core activation, run you through some progressions around that. Then we're going to run through fundamental movement patterns for the back, things that help you just move more efficiently, feel a bit better. We're going to talk about how do we now build our strength up and conditioning as well. So how do we actually build the system up once we've got all these kind of foundations in place? And then we'll talk about putting it all together and the program and a few other things like that. So yeah, outcomes from today. We want to learn the principles of effective back pain recovery, learn the foundational principles of pain, understand the rehab process, learning essential exercises. And ultimately what I really want from everybody today is just to feel confident. You're not going to have no back pain from tomorrow, as much as that would be lovely, but feeling more confident on the journey ahead and what needs to be done and the process and all those kind of things. Just feeling like there is a way out and getting on top of all this kind of stuff. So this is one of my favorite quotes. I'm not sure if anyone's ever read the book Man's Search for Meaning, but it is a brilliant book and it puts a lot of perspective in life. It's something I read almost every year, and it's actually on a poster in my room as well. But everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. And for me, that always kind of resonates. When I had a lot of my back pain, for quite a bit of it, I had probably mentally checked out and given up and thought this was kind of what it is. And really, ultimately, even I was a chiro at that time as well, so I knew a little bit about this stuff. But ultimately, for me, I had mentally just checked out and said, well, it is what it is. And then through a few circumstances, was exposed to kind of the stuff we're going to run through, and really kind of changed my attitude around it, about the fact that sometimes when it comes to chronic issues, it's up to us to take that control and not put that into the hands of doctors and practitioners and things like that. We need to take control and take ownership of these issues, and it's up to us to choose that attitude. So does anyone know who Viktor Frankl is? Yeah. So Man's Search for Meaning, very highly recommended. He was a psychologist who was in Auschwitz. So he was a Holocaust survivor, but he was a psychologist as well. So he wrote this book. It's only 2 chapters in the book. And it is about his experience as a psychologist going through obviously one of the most traumatic things you could imagine, and a lot of just general insights. But that quote has always stuck with me, so now you get to see it. So we're going to talk about some truths and misconceptions around back pain. And this particular study, the graphic is from a study, was written from some of the leading back pain researchers and clinicians in the world. And ironically, a lot of them are in Queensland. So this particular slide kind of broke down all the common myths that we hear a lot around back pain. And we hear it every day in the clinic. And so maybe we'll just kind of do like a show of hands on these kind of things. Anybody believe back pain, especially chronic back pain, is dangerous in the fact that it's red flags, life-threatening? Most people feel relatively safe with their back pain from a broader health perspective. Yeah. So again, very interesting. 98% of back pain is non-permanent. There are some where there's generally got to do more with like major traumas, as in been hit by a car or something like that. But the vast majority of back pain is resolvable, and it is mainly because it becomes a sensitization through the body, and we can retrain that through our exercise, movement, and health behavior change, basically. But that's a big one we often get, especially when someone comes in a very acute setting, very flared up and in a lot of pain. The natural first thought is like, is this, have I done some serious damage here? Is this something that's going to impact me for the rest of my life? Does anybody think age is a factor for back pain?
I mean, it's gotten worse as I've gone.
Sure. Yeah. So interesting. There's very interesting long-term studies. They look at studies for people over kind of decades, basically. And while on our scans and things, we can find more and more as we get older, and we call that kind of normal age-related changes, just like our hair changes a little bit with time, or our skin changes a bit with time. We actually have the same thing within our body, within the spine, for example. But the correlation of pain and age hasn't really been kind of connected. It's more around our behaviors as we get older, or lack of behaviors as we get older. It's those factors more than the spine itself. So big thing out of that is regardless of age, you can improve your pain. What about scans in the back? Show of hands, who's had a scan, an X-ray, an MRI, a CT? Yeah. Oh, we can get Kath to talk as well, actually. Kath was in our Back to Your Best program as well. Yeah, maybe we will. Yeah. She wasn't expecting that. So scans are a huge one, right? Because we go for a scan, and what do we see? We get reports of disc bulges or degeneration or these big kind of words that obviously sound permanent and sound unresolvable ultimately. But most scans can't tell us what is, number one, causing our pain, and number two, we've got long-term studies, again, which we'll show you in a second, that show that even if we have these things on scans, we can have them without any pain, or at least without any significant levels of pain. It's a very normal thing to have disc bulges. Without jumping too far ahead, about 50% of people have disc bulges in their back, for example, without any pain. So we can have them without the pain association there. Pain when moving and exercising. Who thinks that means that it's doing them harm? If you kind of are exercising and you're feeling back pain, you're playing with kids or whatever physical activity it might be.
For me, I always, it's a different type of pain. Like,
Yeah.
so there's the pain that I can feel is beneficial, and then there's like a pain you just go, no,
That's right, yeah. Do you ever feel like when you have that pain that you're damaging yourself more?
I don't know if I think that way. I just think
Good.
this is going to take longer to fix.
Yeah, good, yeah. We'll talk more about that as well on the exercise front, because that's going to play a big role.
Quite often I don't realise I'm experiencing it until it gets to a point where I realise, wow, this is really bad.
Yeah.
I have been putting up with it all day, and then all of a sudden I'll start to do something about it. You know, like
Yes.
stand a different way at the sink.
Yes,
You know.
yeah. The sink, I remember that. We spent a lot of time talking about that, didn't we? Yeah. All right. What about back pain and posture? Who's been told their posture causes their back pain? Yeah. Do you believe it?
Yes.
A little bit, yeah. Really, really common one, big one. Again, the research, very clear as well that there's not a strong connection between the two. We'll talk about more why, but ultimately, it is a very, very common when people say, oh, you just got bad posture, therefore the back pain. And I mean, the thing is that you improve your posture, your back pain improves, so it's sometimes you kind of go, well, they must be causative of each other.
Not just because of that, but it's
A factor, yeah, for sure. We're going to dig into posture quite a bit as well. What about weak core and back pain? Who's been told their back pain's from a weak core? What about that injections? I'm not going to say surgery in this case, because there can certainly be cases, but let's say injection. We did a little thing before about who's had cortisone injections. Can we just do like a raise of hands who's had an injection in their spine? And then a raise of hands who has it been beneficial for? Yep, and non-beneficial. Yep. If you've had multiple, yeah. Again, there was no surgeries. Just one surgery in the room, yeah. So who's kind of been told that, let's say, who has been told that exercise isn't going to be helpful, or chiro or physio, or any of the more conservative measures aren't helpful for back pain? Yeah, so it's always an interesting one when we go to kind of practitioners, medical or allied health, and the options are often injections, medication, maybe surgery. Where the research we'll talk about in a second is the vast majority. These are first and second line treatments for people with chronic pain. These are international guidelines and Australian guidelines that exercise, hands-on treatments, things like that, are the number one thing to go to before anything else outside of really red flag situations, like emergency situations, of course. But a lot of these kind of things, they live in our head. They've been told to us from various people, whether it's friends and family, whether it's doctors or practitioners, and they're going to impact our behaviour, and that becomes a problem. So we will often have people coming in and they've never tried to do rehab, for example, for their back pain, even though they've had injections and nerve ablation and taking X amount of medications. But the reality is those are kind of treatment lines that are generally further down the track. Unfortunately, kind of what the evidence and the guidelines aren't always acted upon in the right order. But a large part of these beliefs is not because of anything else other than medical and allied health. It's a lot of people's beliefs are from their practitioners and doctors that they've worked with, which is a big problem. And it has been a big problem for a long time. So the research around back pain has changed tremendously over the last 10 to 20 years, but the messages are still from back in the day. And so a lot of these kind of beliefs around what's causative of people's back pain comes from practitioners, doctors primarily. And then that impacts what we do or what we don't do with our back, which then has its knock-on effects down the track. So this study was very interesting because it looked at people were looking at their body like a broken machine in a way. So sometimes we hear about like cars and alignments and things like that, which isn't quite the case. We want people to think of their body as kind of like an ecosystem that we're looking to build up and to modify through various ways, because that's ultimately what it is. And so words matter. And this paper was very interesting. They looked at which line or which direction did people go down to with their recovery path with back pain if they were used more medicalized terminology, so things like degeneration, for example, like a word like that, versus words like, age-related changes. And those two words or those two things could be describing the exact same finding on a scan, but the patient's behavior and attitude about their recovery and direction in which they sought their treatment was very different. So when we use more medicalized terms, we typically will go down the pathway of injections and ablations and medications and things like that, being a bit more fearful, I guess, of exercise and building the body and challenging the back. Versus when we use terms like, just age-related changes, which is a big one that's being pushed at the moment, which is a good one, which is going to be more, okay, that's fine, I can build myself up, I can train, it's safe, and we'll take more exercise, rehab-based approaches to our recovery. And again, clinically, we see that very, very often where people will use those terms. As a clinician, I'm always listening for the words that people use about their own back. And you can tell based on what's been told to them, obviously, in the past as well. So words matter because they will dictate a lot of the direction that you take on your health with this stuff. Is there any questions on that, by the way? Make sense? Yeah, good. Cool. So, imaging. Has everyone had a blood test at some point in their life? And on the blood test, it kind of comes back and it says, these are the normal ranges, this is where you are. So there's a push at the moment to try get that onto scans as well. Give people parameters as what is normal on a scan for someone of your age and your gender, so that we can kind of know, are you sitting like roughly in the norm, or is this more advanced than other people? And there's a push for this primarily because we know when we scan people who are asymptomatic, that means that they do not have any symptoms. And they've done this study with quite a few thousand people. Let's use this one over here. So this over here is from this particular graphic. In fact, I'll use this one here. So there are decades here, 20s, 30s, 40s, 50s, 60s, all the way up to 80s. They scanned people at those decades. And they were people without any back pain or without any history of back pain. And they were looking at what was going to come back on those reports. So if we take disc degeneration, if you're in your 20s, about 37% of people will have reported disc degeneration. When you get up to your 30s, about half the population will have reported disc degeneration. Remember, this is for people without any back pain. When you get up to 50s, 80%. When you get up to 70s, 93. So you can see there's almost a linear kind of thing that we find. That's why we call them normal age-related changes, right? As we get older, we just find this stuff. Does it mean that it's bad? No, it's just normal changes, just like we accept the color of our hair changes over time. If we look at disc bulges, 30% of people in their 20s have reported disc bulges, no back pain. We go up to the 40s, 50%, 60, 69, 70, 7, 84. So it just becomes this linear thing that as we get older, we're going to find more and more things. And this is why it becomes quite challenging to look at a scan and go, well, that's why you have your pain. Because who knows that maybe the day before when you didn't have pain, if we took the same scan, we would have got the same report. Right? There are certain signals we can look for on scans that tell us if there's inflammation associated with it, and we know if there's inflammation that might be associated with pain. But that inflammation typically is short-lived, and if you scanned yourself again a month later, you could have the same report without the inflammation, you could still have the pain. So this is why scans aren't the be-all and end-all when it comes to back pain, and why we need to be very cautious about going for scans too early, and we'll talk about those guidelines in a second, and a bit cautious as well of just taking it too much on board, because many people look at a scan and kind of go, well, that's what it is. That must be the cause of it. But we know that most people will find the stuff in as well. We see this interesting thing every now and then where we have people say with knee pain and they'll go for a scan, and occasionally there's a particular doctor who I really like, and he'll send them for both knees to be scanned. Usually you'll just send for one, but this one, he goes for both. And they'll come back more often than not with the same report for both knees, but one's the painful knee. And then we can kind of say, okay, well, let's just build the thing up then, because obviously the MRI is not really picking anything different up on that. It's a nice kind of little experiment I think he does primarily. Does that ruffle any feathers at all? Get anybody thinking a bit about scans and the reports and things like that? Yeah. So it's always an interesting slide, this one, because it does highlight a few things, because we often hold on to our scans. I held on to my scan when I got an MRI early after I had a back flare-up from lifting weights. By the way, my background, I had 4 years of back pain. I was CrossFitting and I was trying to get back into CrossFit, and every time I touched a barbell, my back would just blow up and I'd have a month of back pain and nerve pain, and I'd wake up in the morning and I couldn't even drop my head down without shooting pain all the way down my leg. And I had a scan early on, and that was that was kind of why I had given up, kind of, so to speak, at that point in time, because the doctor who I had was like, well, that's what it is, not much you can do, blah, blah, blah. But it does impact. It lives in a little space sometimes in our head and can put a bit of fear into us as well. But hopefully knowing that there is what we call normative data, this is people without pain having these issues, and knowing that regardless of what you found on there, these are people with the same things without any pain, so you can get back there as well. The main way that we actually diagnose is more through orthopedic and neurological testing than the scan itself. And I'll give you another example that we see semi-regularly, which is the reports coming back saying this person has a pinched nerve. It comes back in different words than that, but ultimately a pinched nerve. But when we test them and do everything, it's like there's nothing there. There's no...
So that was about 4 weeks ago, and I haven't got it.
Yeah. Do you have leg-related symptoms though? Or constant, or just on and off?
On and off.
Yeah, on and off's a better situation. There are absolutely times where I send people for scans with leg pain, but for the most part, it is unrelenting pain for them. Like, it is constant. And things like walking, where they just lift their leg like that, is enough to send shooting pain all the way up their back. So if you don't have kind of that kind of stuff, by the looks of it, you probably don't at the moment, then you'll see what we're going to do in the mobilization and stretching. We're going to do neural stretches, which in your kind of case will likely work really, really well. Yeah. The other thing that kind of comes up with this stuff, which is really interesting, is most of the MRIs are done laying down. There are MRIs that you can do standing up. And years ago, we went to a presentation with a group of doctors who were selling standing MRIs for clinics. They cost just short of $1 million, so I don't know how many sales he got. But the point he was going, he kind of took the same people, put them in the MRI laying down, then put them in the same MRI standing up, and completely different reports. Because when we're weight-bearing versus when we're non-weight-bearing, how the structures act are very different. So some people will have a lot of pain standing, for example, and they get like leg pain and stuff, but then they go for their MRI and they're laying down and the MRI kind of comes back, it's like, yeah, not much going on there. But sometimes you can stand and things are a bit different. So that's another limitation on scans as well, is that sometimes we lay down and versus standing and we can get completely different reports. Cool. So I'm going to introduce you guys to Adam before we move on to the next one. So Adam was kind enough to come by. And he's going to just tell you just kind of 5 minutes or so of his background. He can talk a lot. So, but Adam is part of our Back to Your Best rehab program, where we train people with chronic issues back up. And he's asked him, because his story is very inspiring as to when we started versus where he is kind of now, and hoping that it just a bit of hope for everybody, because when we started working together, we were really slow, like to start. Absolute basics. I remember we were here in our first session. And we were really just starting just simple things like on hands and knees, just learning how to move the back without pain. But anyway, I'll let Adam kind of run you through his where you started, and
yeah, sure, give a bit of history,
background, and where you are now.
It's pretty cool standing up there listening to this. It brought about 10 years of my experience together, and I think Dan's doing a really good job summarising what I had to go through, multiple different practitioners to acquire. But when I came here, I'd just finished up 21 years in the Air Force. I got medically discharged because of my lower back. My L5-S1 was basically destroyed if you look on a scan. So when you look on a scan, it was black and angry, bulging discs, and I saw 2 neurosurgeons. Both wanted to fuse, and I didn't want to fuse it, so I went and saw a third neurosurgeon who basically identified that it was an atrophied multifidus muscle. Anyway, I ended up getting a little neurostimulator put in. Even 9 months after that, no change, still no help, and my friend recommended Dan, so I came along. Now I'm like, oh, fucking chiropractors, like, because I used to see a chiropractor down the road, who at the time I thought was good, but I saw him about 2-3 times a week, about 6 years, 600, 700 appointments, and I'm like, no improvement. So yeah, Dan's not your usual type of chiropractor.
No, don't like the fucking chiropractor.
Yeah, God, so I had the 2 rounds of nerve ablation, I had multiple CT-guided injections. Like, I couldn't sneeze, get off the toilet. Like, it was ridiculously bad. And I had 2 young kids. So I'm super excited for you, because last week, we did sprints. Did some sprint training. I'm jogging again with my wife, riding the bike. I tried to do the 10,000 kettlebell swing challenge. I did the 10,000 push-ups, or what is it, 3,000? So there's hope. All right, and that's the key. You've got to take the responsibility for your own healing journey. Like, no one's going to crack the thing or rub the thing or take the pill. You've got to do the work. So if you do the work under the guidance of these really well-trained people, you're going to get better.
We've got other people who've had made multiple spinal surgeries. And so sometimes we hear all this and all sounds like good and well in theory, but there's people like that walking around, Catherine as well, behind the camera there. Didn't have surgery or anything, but was on the verge of potentially having surgery. A lot of leg symptoms and things like that, and she's all good now. You're all good, aren't you? Yeah. But I guess the point out of all that, the body is highly adaptable. And when it's given the right circumstances and the right amount of time and you're consistent with it, it will adapt. Just like fitness, in the same way that if you want to be able to run a marathon, you're not going to do it tomorrow. But if you ran just a little bit, every week over a few months and a few years, you're just going to build up the capacity to do it. And the back is exactly the same way in which it adapts. So what are the kind of guidelines? Is this just me kind of making crap up, or is this kind of the guidelines that are followed? So evidence for treating back pain, these are the guidelines. They're Denmark, UK, US, but Australia are exactly the same. First line treatments is advice around staying active and patient education. So we want to keep people as active as we can. Exercise therapy, CBT, which is like a cognitive behavioral therapy, is like a psychology intervention. Second line treatments are more like the hands-on type things. So they can obviously be done in conjunction. That's what we do. Adjusting and massage and acupuncture, yoga, mindfulness-based stress reduction. And then if the above treatments fail, maybe a cortisone injection or certain medications and potentially surgeries. But these top 2 things sort out the vast majority of back pain. Outside of emergencies, obviously, but the vast majority of people, about 95, 98% of people with back pain, with the right amount of time is kind of the thing, and the right advice and those things, most back pain will be resolved really well. So again, we kind of make a big fuss of this, but why is it actually important to kind of address these things? And one of the key factors for people who go from just an acute back pain flare-up, settles down, recovers, all good, maybe never to really have it again, or for it to be very minimally impactful in their life, to flare up, and like myself, for example, flare up into 4 years of back pain. What's the thing that causes someone to settle down and be all good with their life, or to end up with a long period of back pain? And the term in the literature is called kinesiophobia, which is fear of movement. And where does that come from? It comes from what we're being told, right? If we're told that we're vulnerable, if we're told that we're weak, we've got a weak core or bad posture or whatever it might be, we become a bit fearful of these things. And if we become fearful of them, what do? We avoid the things that are provocative for our pain. So for example, if you've ever heard like bending is bad for your spine, I forgot to mention that one before. That's a huge one as well, right? Bending is bad for your spine. It's not at all. It's a basic function of the spine. Our anatomy is driven to bend. But if we've told that it's bad for our back, what are we going to do? We're going to avoid it. What happens when we avoid things? We decondition to it. What happens when we decondition to it? It makes a whole other issue that we have to now rebuild things back up. So getting these messages right is important because they can be the thing that either settles you down never to think about it again, or if you're given the wrong messages, can lead to a period of time of chronic kind of issues. And so a big thing, at least in our clinic anyway, we're aiming to ensure that we retrain not only the body but the mind as well to trust the back. And this happens through challenging our fears. We've got exercises that we're going to run through today that are going to be bending and extending of the spine exercises. They're going to maybe challenge some kind of fearful or maybe some just apprehensive kind of movements and positions. Dad life or mum life, like that's where you live, right? You're looking after the kids, you live there. So we need to make sure that we're conditioned to do that so that the body doesn't see it as a threat, doesn't cause pain, things like that. So that's why we make a big deal out of it, because we never want people to be fearful of their own back or their own body in any way. So then it kind of comes to the diagnosis side of things. Adam mentioned this a little bit before, which was, we don't make a huge fuss out of the scans. Of course, we look at the scans and, we come up with a diagnosis. It's kind of important to have a good diagnosis. But we don't get too stuck on it. We rather kind of treat the person. We just look at what are the things that are provocative for you? What are the things that you're fearful of? What are the things that you're apprehensive of? What are the things you need to do? Let's address all of that. You can have, a disc bulge and maybe some nerve pain, and we kind of do some testing and find that bending forward triggers your symptoms. And while for a period of time, we might say, yeah, let's just peel back a little bit, just let the system calm down a bit. After a week or two, we want to start to retrain and recondition the body to be able to bend, for example. And then we look at what are the tasks you need to do? Everybody, needs to work or has family duties that they have to do. So are we going to avoid those completely? Not really. We have to recondition, so we can cope with them and we can deal with them. And so when we kind of approach our treatment and our rehab plans, we look at it through the lens of Patch Adams. Has everyone seen Patch Adams before? Yeah. Not generationally missing. I don't know what year it came out in, but I think some of the young people, when I've mentioned it in the past, have no idea. Look at me with blank faces. But
a long time ago, Daniel.
it probably was. I don't know what year it was. In the 90s? Yeah. So, as Robin Williams says, you treat a disease, you win, you lose. You treat a person, guarantee you'll win no matter what the outcome. And in the back pain world, that's kind of what we're going to do. We're going to look at the person. What are your goals? What are your apprehensions? All those kind of things. Let's put a plan together to address all of that. Let's not worry so much that the report said degeneration, bulge, all these hardcore terms. Let's kind of just put that aside and let's kind of look at it. Let's build you up. Let's just build the system. And that's really the approach we kind of take. It takes away that kind of mental connection of I am my scan, right? Or I am what I've been told in the past. And so as clinicians, we look for the triggering tasks and create a plan to desensitize the person. You'll hear me use the word desensitize a lot because I prefer to look at it through that lens. We want to desensitize the person to the task that causes them pain. And then we want to build up resilience and confidence so they can go ahead and keep performing those tasks as well. Okay, so now we're going to kind of come into the generally kind of creating the plan a little bit. And I'm a very simple person and I break in my head when I'm talking to someone. I'm just thinking, what are we doing too much of or what are we doing too little of? Things that are often too much of, we work with quite a few people who are very active, who train a lot, and sometimes we look at their training load. Yeah? Hey, train twice a day, 7 days a week might not be the best thing right now for you. But, let's peel back just a little bit and see where we can find that point where your body can cope with X amount of training. It might be somebody who works in an office and they're sitting 8 hours a day, 5 days a week. They're sitting too much. Okay, let's start to get you moving. Let's put a plan of action to take that down a notch, get you moving a little bit more, get you changing positions a little bit more. Likewise, on the flip side, they might be doing too little of something. They might not be exercising enough. We see that quite often as well, especially for people who are fearful of their back pain, right? They stopped exercising, they stopped moving, they really become a little bit more sedentary. So guess what we need to do? We just got to get at least to begin with, get the body moving a bit more. Activate those muscles, improve your cardiovascular fitness a bit, improve your flexibility a bit, improve your strength a bit. Always just finding that balance. And it's a good reflection point I find for people, which is if you just think about your own life, because that's where it always comes to. This is what I ask people in the clinic all the time. It's like, what do you think you do too much of? What do you think you do too little of? And if you kind of break down your demands around your work and demands with your family and demands with your exercise and all that kind of stuff, often we can kind of go, yeah, you're right, I am sitting a bit too much. My steps, when I look at my watch and count the steps, I'm only at like 5,000 a day or 4,000 a day. So let's start there. Let's just build things up a little bit. But it is a really good reflection point, because we can build our strength up in everything we're going to do today. But sometimes there's still these triggering things of, hey, I was actually at Housemouth Walls yesterday with a mate who's having a lot of back pain. We were talking about this very thing. And I'd done a program with him. He'd come to my place to do some training with me for his back. And he was like, still having, much better, but strength-wise, mobility-wise, still having these issues. And we kind of went, oh, tell me about work. And he was like, literally, his work is based in the Gold Coast, but he works with a team in Italy. So he's like, he just sits like up until 1 a.m. in his chair, not moving for hours. It's like, okay, well, we need to address that as well, right? You're doing well on the strength and mobility front, great. But there's still going to be stuff in your day that is going to be triggering to your back, and we need to modify that. But guess who's the best person to know that? You guys, obviously. Does anybody, while you're just kind of thinking on it, is anyone thinking there's particular areas you could make some change to? Okay. So what actually causes the injury? What causes the pain itself? Again, there's more or less two. Obviously, there's a lot more complex than what I'm making out. This is a very simplistic, reductionist kind of approach, but it is a good, just simple way to think about it. Is on the left here, we can see the red line is what's called our tissue tolerance line, how much force or how much load our back is willing to take before it gets painful or injured. And when we have loads that are down there, where we've got a safety margin there, like it's not going to stress the tissues. It's like, I don't know, lifting something up that's well within your capacity versus with lifting something up at moving houses, and you have to lift a stupidly heavy piece of furniture that's really pushing you beyond your physical abilities. So if we kind of lift something light, obviously nothing really is going to happen there. If we push and do something well outside of our zone, then our risk of injury goes up. So we can injure ourselves through that mechanism, just doing something that's just way too hard for the body that we just not conditioned for. Does that make sense? Pretty, normal, simple kind of thought about injury. Then we got the opposite one, which is the more common one I find in the clinic. It's very easy, by the way, when someone comes in and they said, I'd try to do the heaviest deadlift I've ever done and my back got sore. It's like, okay, well, let's just peel back a bit then. That's quite easy. But what happens when we go and we bend down to tie our shoelace or to pick something up and the back goes like that? And we go, what the hell? I've done this a billion times before. This isn't a heavy load. It's not a big thing, right? Has anyone had that experience before? Just like a normal little task and the back just seizes? Yeah. Everyone? Yeah, more or less? Yeah. So very, very common. So in these kind of cases, what we're looking at is not that the load or the task has changed much, but rather our body's ability to deal with that task has gone down. So these things often happen when we are we're either not very well rested, like we're a bit sleep deprived, or we're stressed, when we've got other health issues going on, right? When the body's fighting something else, when there's other things going on around and the body's ability to deal with normal things doesn't do so well, right? So that's very, very common for many people with back pain. It's like it always happens when I'm going through stressful periods, my back is worse, or the flare-ups are more aware, or my workload is tremendously high at the moment. That's when it happens. I mean, it always hits us at like the worst point. Has anyone had that as well? It's like you got lots going on and then this happens. Yeah, right? There's the correlation between that. When the body or the system is under a bit of strain, these things are just more likely to come about. So then we kind of go, why? So what does the rehab and the training do? Well, rehab and training ultimately just build a huge amount of capacity in our body so we can deal with more things more often. It is just adding stress on the body in a way that it is adaptable to and non-threatening to, that allows it to then cope with bigger and bigger tasks over time. So that's why we talk on improving our strength and our mobility and getting good activation through certain muscle groups and improving our cardiovascular fitness, is because it gives us more capabilities and more capacity to deal with things. And so you can see over through here, the buffer zone, the safety margin, becomes bigger and bigger, right? The more function we have in the body, the more abilities we have, obviously the bigger the safety zone there. Is it a bulletproof way to never have pain or injury again. No, like things still happen. But your recovery, the stronger you are, the more mobile you are, all that kind of stuff, your recovery is generally a lot better. If you have a flare-up, Adam will tell you, like he'll still have occasional flare-ups, but he settles down within 24 hours and he's back to normal. Your recovery is better. The intensity of the flare-up is often less. Your ability just to kind of continue doing other things, mentally you're in a much better place for those flare-ups as well. So we learn a lot through building the system. And you'll hear me talk later about the program that it doesn't happen in 12 weeks. I've given you a 12-week program, but you can just keep doing it. But it doesn't happen just in 12 weeks. These are things that like you build up over time, right? If anyone knows anyone who's trained and exercised for a long time, their base of fitness is tremendously high. And my wife's a pretty good runner. She won't like me getting this on video, but she's a good runner. We've had 3 kids. She hasn't run for very long, but she's back like to 7Ks pretty quickly. Like for me, 7Ks is a horrible day. Sorry to disappoint you, Pip. You might not like that. But for me, like her baseline is so much higher just because she's been running for years and years and years. And I do the little thing of like trying to get back into it, and I'm like, don't love it. No, that's it. So my strength baseline, yeah, exactly right. So, the longer you're in the game, I guess is my point with this, like the longer you just stick with it, and you guys, people who've trained for a while will know this stuff. The longer you do it, just the higher your base is. We sometimes say it's not about raising our maximums, it's kind of about raising our minimums, right? If you've been running for years and years, running a 5K it's not a huge task if you're used to running marathons. But if you're not used to running marathons and you're not used to running 5Ks, 5Ks is a big task. But if you kind of slowly build up and in 5 and 10 years you've been consistent with some strength work or running or whatever it is that you enjoy, and you've been consistent with it for a long time, your base level is just so high. Think about all the Olympians at the moment. Like for them, the swimmers I think last night in one of the races, I think it was the Titmus, what's the American lady's name? Aria. Yeah. It was in one of their heats, and they're like, just so you guys know, the commentator said, just so you know, this was their time. The actual world record's like 8 seconds faster. They're just taking it easy. And the time was insane. It was like, I can't remember what it was, but it was like, I was thinking about my swim, like, that's wild. But they're just still like only at like 90% of their ability. It's just because their top end is so high. Right, so you just build the stuff up over time, but you've got to be thinking longer term, more than 12 weeks, more than a year. You're thinking, this is a real health, deep health change that you're looking for. So the general kind of rule here is when the task load is greater than our capacity, likelihood of injury goes up. When the task load is less than our capacity, we might be doing kind of recovery and rehab, so if we're doing like light and easier stuff than usual. And when our tissue capacity, when our strength and fitness is all the way up there, and what we need our body really just to be ready for is only down here, that's where we're talking about prevention. Does that make sense for everybody? Yeah. Okay. Perfect. All right, so we're going to get into the physical stuff in just a second. So lastly, the other little simple mental model we're going to use, and you'll hear us talk a bit about this today, is when do we use what exercises and when should we kind of lean in on strengthening the body, or when should we lean in on more stretching and using foam rollers and things like that. And the simple rule is kind of this. There's certain strategies that are there to help pain management, and there are certain strategies to help build us up. And while we're having a flare-up, for example, we're probably not going to go and lift like heavy weights or go for a big run. But what we might be doing is leaning more on the things that are there to calm the system down. So that's these kind of things over here. The common things that are going to calm our body down and just get our pain levels a bit to a more manageable position. Rest is an easy one. Foam rolling, trigger ball, stretching, mobilizing, general moving, going for walks, things like that. Heat, ice, creams, heat creams, things like that. Medications, injections, surgeries in big situations ultimately, or red flag situations. TENS machines like electrotherapy. Those are like common ones. They're good. There's nothing wrong with any of that stuff. They can be very beneficial to manage our pain, but what they don't do is they don't build the system up. All right, so that's the limitation. Is we'll hear people they've had pain for a long time. They'll say, "What have you been doing for it?" And they'll list off a bunch of these kind of things, which is fine, understandable. They just want improved pain, but what they're not listing a lot of the time is the stuff on the other side, the stuff that builds the body up so that we don't have to deal with the pain. And there's a time for that, of course, when our pain is more manageable, not during flare-ups, but when it's just a bit better. So these are things like strengthening the body, flexibility training, skill and coordination development. So just learning new ways to move and learning new kind of skills. Mindfulness, mental resilience, nutrition, improving your sleep, improved stress management strategies, and improved relationships and personal time. And what's the theme there? These are just health things. They're not back pain things. Let's just get a healthier body overall and improve. Now, obviously, you don't have to do every single one of those. Just kind of pick out the things that are most important. But I like to use that little mental model of, hey, you flare up, okay, let's lean in on these a little bit for the next couple of days. And then as soon as we're feeling better, let's come back and start to build again. So not spending too much time, living in that world there. Does that make sense for everyone as well? Okay. Awesome. Now, just very quickly here, this is kind of the rough process we take people through. The first phase when we work with people is around symptom management. That's when we will utilize maybe more strategies like these ones. Sometimes we'll still use strengthening. It's not like you can't do strengthening. Some people do strengthen, they find it helps their back, so we do that. But generally in the first phase of recovery, we focus on just getting their symptoms down to a level that they are comfortable with. Doesn't have to be a 0, but just to a point where they feel okay to start to build it back up. We then start to rebuild and recondition the body. We aim to get people back to kind of a baseline level. We'll talk about some of those kind of things in a sec. And then we kind of go into the prevention, which is, again, just building the body right up so that we don't have to kind of have these issues anymore. So that's the rough kind of process. Okay. All right, let's get up and get moving a little bit. So having a whole bunch of back people sit down for back pain people for 45, 50 minutes. Then we're going to talk quickly about sleep and stress. Sleep and stress have a tremendous impact on our experience of pain. Doesn't affect the back specifically, but more the experience of pain. When we are sleep deprived, the little analogy I use, again, my wife doesn't like me using this analogy so much, but it's when you're a parent with especially young kids, maybe older kids, but I've got the experience with the young ones. When you're well rested and you're not stressed, your patience with them is kind of endless, right? They can get away with a lot more before you get a bit grumpy with them. When you're a bit sleep deprived and on edge and you're stressed, that fuse is a lot shorter, and they're not going to get away with too much on those kind of days. And pain is kind of the same, right? So when we are well rested, there's not much stress, or we're managing things well, all life is just good, our tolerance to pain is significantly better. We don't notice it as much. We tolerate it better, meaning that even if we do feel it, we kind of go, it's okay, carry on with our life. When we aren't sleeping so well, when there is lots of stress and a lot of busyness in life, guess what happens is, we get frustrated with it. We feel it a lot more. And so that's the importance of working on our sleep quality and quantity as best we can. So of course, never going to be perfect, but doing what we can within our control and making sure that we've got good stress management strategies. And the little kind of thing for our sleep, our little recommendation is try go to bed at the same time each night. Try have a boring 1 hour before you go to bed, meaning try not to be on the phones and TVs and being stimulated. Try be bored. It's a good thing to be bored. It helps you just down-regulate, helps the brain just kind of switch off a bit. Do something to down-regulate, could be yoga, meditation, or reading, and try create a comfortable sleep environment. Right? So try do the things within your control. Again, I've got 3 kids at home, so I get it. It's not always exactly textbook kind of approach, but you do what you can, of course. Then stress management, always make sure you've got someone to talk to. If you're going through a lot, just talk to somebody, someone you trust, of course, psychologist, friend, family, whatever. Try to take action on what is within your control. Find a practice that helps you manage, so stress management kind of practice, meditation, yoga, whatever it is that just helps. And always just kind of remember the big picture if you're going through a real stressful time. Sometimes just having those little strategies just helps. Alrighty, so that is all the ramble from me. There'll be more ramble, but that's the majority of it. Any questions before we move on to the practical? Okay. Ask lots of questions, hands up. Ange and Lou will be around. We're all going to kind of make sure you feel every exercise. If you have questions, if you can't do anything for various other issues, you just let us know. We'll give you different options. And the way that we're going to work through it is we are going to run through the exercises first, and then me, Ange, and Lou will run through them demonstration-wise, and then we're going to go out, you can partner up, and then we're going to come around and make sure it's all looking good. I want you to take mental notes on the positions, the exercises that you might have pain with, right? Because just note it mentally, because we want to then work on that. If you have pain when bending forwards or backwards, guess what? Those are things we're going to lean into to make sure we desensitize and improve your function in that regards as well. All right, so the first thing we're going to start with is breathing and a body scan. It sounds a bit odd, but we're going to use our breath work for every exercise that we do from now on. We're going to use a little body scan technique, which is just kind of eyes closed. We're just going to scan through our body, gauge what we're feeling. Could be pain, could be tension, tightness, just holding a little bit of stress there in the shoulders. We're going to kind of just try internalize a little bit and again use that throughout the exercises. So Andrew, I'll grab you if you want to come here. So this is all we're going to do. So if you want to lay on your back for me, knees bent. We're going to find a comfortable position. I don't mind if you struggle, eyes closed, and we're going to learn to do what's called diaphragmatic breathing. Has anyone heard of that before? Yeah. So diaphragmatic breathing, the way that we're going to get you to do it is you're going to take a deep breath in through your nose. You're going to imagine like there's a balloon in your belly and you're trying to blow that balloon up deep. So you want to feel the abdomen nice and low kind of expand first, and then feel the midsection and eventually the chest. On your breath out, it's just a very relaxed exhale. It's not a forceful exhale. You're not, it's just relax. You're going to do 5 breaths to begin with. And in that 5 breaths, we're going to just do a little body scan. You're going to start by just observing your shoulders, seeing if you're kind of holding tight through there. And if you are, see if you can kind of soften your shoulders a little bit. The state that you're in is actually kind of a bit of a tense state in certain areas. And we want to just mentally take note of that because we're going to use that again through the exercise. We come in through our nose, the breath out will come out through our mouth. So we're going to take our first deep breath in, nice and slow, filling the abdomen all the way deep through the core. And the breath out is just relaxing. Just let the breath come out. And then we'll start the body scan now as well. In fact, we'll start up at the jaw. So just checking at your jaw, just feeling and things like that in a second. We're going to mainly focus on keeping that good breath work, so good diaphragmatic breathing. And we're going to just be really mindful when we do it. Just be aware of what we're feeling. Because that connection that we create with ourselves is very important. And we start to learn a lot about ourselves through that mechanism. Does anyone have any questions on the breath work? Good. This is how I really like people starting a lot of their kind of rehabby stuff as well, by the way. It's just breath work. Checking in with your body. It helps to get a real good mindful connection. And you generally feel nice and relaxed after as well. If you feel a little bit dazed or a little bit kind of chilled out. All right, so we're going to start first with sitting on it, and we're going to roll a little bit onto the side as well. And she's just going to kind of explore around the hip, finding any little sensitive or tender spot. And she's going to focus again on maintaining her kind of breath work, which is this area over here. So we're going to lay on our back and then kind of rotate a bit to the side a bit. We can always do these standing, by the way. So if anyone's looking at this as it's going to be too hard laying down, the standing variation, very simple, up against the wall. And then we can gently kind of roll up and down or mobilize through the back there. So step 1, and when we do this stuff, breath work. Step 2 is maybe a little bit of release work. It's certainly optional. Like I don't do a lot of it. Or backwards, that's it. Depends which way you define it. Yep. And then we're going to go the other way, so arching right forward. Kind of. The difference between this and cat to cow is this, we're trying to just move that particular area. Whereas a cat, if you wanted to show the whole, we're going to go the whole thing. We may as well just do it now because this is the other one. So this gets the whole spine, including the neck, whereas the pelvic tilts are mainly aimed at trying to isolate movement just through that region there. So that's the kind of difference there. We're going to do both, but to begin with, we've got our pelvic tilts, slow, controlled breathing, getting that bit of awareness around how to move those areas. Then the second one will be the full cat stretch. So this is when we're going to really get chin to chest and then get a full back arch on the way back, head all the way up as well. So now it's the whole spine kind of involved there. Yeah. This on the ground for as long as we can, so the front of the hips basically, keeping them on the ground, and we're just kind of up and down, nice and casual breathing. You're only going to work in your comfort zone, of course. That's the whole point, is you just find your comfort zone. You're going to go up and down. Some people might find this particular position, they might even be looking at it kind of going, oh, that looks like it's going to be painful for me. You start small and you can go up onto your elbows if you need to as well. Good. Then we're going to go into scorpion. So for scorpion, hand position out wide or in a kind of a bent position. And we're going to roll from side to side. And we're going to lead with the foot on this one. So with Ange's left foot, sorry to stop you there, you're going to lift it and reach it across. Okay. Again, it's all within your comfort zone. You probably, you may not get the range that Ange gets. We have an ongoing joke with her in the clinic. Nothing gives Ange a stretch. She's pretty flexible. So you're going to find the comfort zone. It might only be partial range. So if you want to run through some partials, so it might only just be to there or even less potentially, whatever is within your comfort zone. And then finally, we've got our windscreen wiper, which is on our back here. So palms out wide, knees up, and we're going to rotate from side to side. And the purpose of these three is you will feel muscle stretching for sure. Looks okay there.
Yeah, that's probably one of the things I struggle most with is remembering to breathe.
Holding your breath, yeah. Especially for this one, people will struggle a bit because it's kind of a bit core-ish.
Yeah.
By Ange, not by me, by Ange. So this one is about what we call neural flossing. It's kind of just getting the nerves that run from your spine down your leg moving up and down. It's a very nice stretch. Some people find it's quite tight and sensitive. Some people won't really have a huge issue. But what we're going to do is we're going to start by dropping our chin to our chest, curling through the spine. So we really want to slump through that area. Then with one leg, you're going to straighten it out. And we're going to start with toes pointing away and head down. And then all Ange is going to do here is lift the toes up and lift the head up at the same time. And we're just going up and down like that. And it's kind of like flossing your teeth. We're taking that nerve and we're just moving it up and down. Now, depending on what's going on with your back, some people have a bit of tension here. You might not even be able to get a straight leg just yet, which is fine. You'll just start within your comfort zone, of course. Some people will be perfectly fine. But it's a good little diagnostic to see if there's a bit of that neural tension component, which many people have.
This exercise saved me.
Brilliant exercise, yeah. When it's done in the right time for the right person, yeah. Just remember, toes pulled up, and we're going to straighten just into a stretch and then back down. You don't have to come all the way back down, so just into the stretch and back down, just like that. Now, Ange started up there because that's how she feels the stretch. For most of us normies, we're going to be kind of at that 90 degree. Yeah, that's it. Just up and down like that. So this, again, will give you a bit of a stretch through the back of the leg. If you've got a bit of neural, you might even feel a little bit in the back, which is fine. You're not going to be aggressive with either of these, of course. You're just going to nice and comfortable. Cool. So let's give those two a shot. Sometimes in the back.
Through there, maybe move out through here.
Does that feel similar to some of those leg symptoms you sometimes get? Yeah. This will be one that you'll do really well with then.
And how many of these?
Just up all the way down. Good. We've got 2 more minutes on these ones. Make sure you've compared left to right. Self-massage. We then did mobilization. We then did some neural mobilization. And now we're going to do stretching. Okay, so stretch is very, very important, of course, as well. The key with the stretches, at least how we kind of like to coach it, is longer holds. So anywhere from like 30 to 60, even up to 90-second holds. So we're going to go for longer holds. And this one, I definitely want you to have that kind of eyes closed, deep breathing, sink into a kind of approach to your stretching as well. And so we're going to start, we're going to do supine glute stretch. We'll use Lou, yeah. Like Ange's, just looks too easy for Ange.
I'm very flexy too.
You're as well, yeah, of course. So onto your back. So we're going to do, again, just move around if you need to. Roll across, and we're looking to feel the stretch on the outer part of the glute, maybe even a bit into that lower back. Okay, not too aggressive, right? Breath work, that's our kind of way to pick our intensity here. Shouldn't be so hard that we couldn't hold a conversation with somebody. But you're going to get in there and you're just going to take 3 deep breaths, just like we did at the beginning, obviously on the left and then on the right. Then we're going to do, I'll make sure I'm going in my right order. And we're going to go, let's do child's pose for you, Ange. If you want to set up child's pose, I'll use you again in a second. Second one is child's pose. So for this one, bum back onto heels, sinking deep into it. So we're looking obviously to get more length through that area there. 3 deep breaths in, and we're trying to breathe deeply into the abdomen or deeply into the lower back through there. Now for this one, if you want to, you can also shift your hands off to one side if you feel like you want to, and you'll get obviously more of a stretch down one side. It's a really nice way to kind of open the back that way, and you'll do both sides there as well. Beautiful. Then we're going to do couch stretch. Now, we might actually just do it as a general hip flexor stretch, I think. So we'll go into a lunge stretch with Lou. So nice and tall here. We're going to start by squeezing the glute, this leg that's on the ground. You're going to squeeze that glute, and you're going to lunge forward, maintaining an upright posture. And again, we're going to hold at the end point for 3 deep breaths. Okay. And then come back out. You might do 2 or 3 on each side as well. Back. Most of us have probably done this at some point in time, just using a band or a towel or something like that. And we're just simply stretching, and again, 3 deep breaths there. Awesome. Yeah, if you want to maybe pass a few around. Fullness. Use your body scan. In the child's pose, one of the nice little cues you can think is about trying to get your butt and your fingertips as far away from each other as you can without kind of shifting your weight forward. Yeah, that's good. Knees, neutral spine. Angela's going to keep her leg bent to about 90 degrees, and she's going to lift one leg up in the air. So we are going to come up through here. We'll keep it bent actually. So up like that. If you push up into my hand there. So we want to see some activation around that glute there as we do that. So pushing up. So it's intentful, meaning that we are thinking about pushing against that. Lou, Angela and I will come around and make your life a bit difficult during that one. And if we need to, we can always use, and we're going to come back down. So driving through the heels, big squeeze again. Depending on your fitness level, your strength, things like that, this might engage a lot. It should there. So that same good control, pressing firmly into the ground. So what I want you to think about on these ones is pushing the earth away. Drive, drive, drive. Does that feel okay? Can you feel some work being done there?
Yep.
Good.
A little bit.
Little bit? Oh, don't tell me that. Just push harder. It's going to make you work harder. That's what we want there. Good. It's me. Nice. Can you feel that work a little bit through there? Yeah, good. Excellent. Come back down. Let's go the other side. Hands are going to start straight up in the air. Knees are going to start at 90 degrees to the ground. So tabletop position with the legs in this position here. The purpose of this exercise is to keep our back glued to the ground. So what we don't want, if you want to arch your back, is to lose the connection to the ground. We want to try keep our back stuck to the ground throughout the movement. And what we're going to do, depending how switched on everyone's brain is at the moment, we're going to take the opposite arm and the opposite leg and extend them all the way out until they touch the ground, if we can get there. And then come back into the middle, stabilize our core while we're moving our limbs, walking, right, running. Anything that involves this kind of cross crawl kind of position. Now, if you can't get all the way without arching your back, you're just going to bend your knee. This is why I give these kind of cues of keep your back flat. That means this has to all stay tight anyway, but you're not actively like tucking anything in. Yeah. By the way, there's nothing wrong with like actively engaging. Like in Pilates, they teach that a lot. There's lots of reasons to do it. The way that we approach it though is I prefer different. So that's it there. And just actively pushing the ground away with her elbows. So she's not kind of shrugging and kind of losing. If you just want to kind of, yeah, she's actually pushing away. That's the position there. Then she's tightening her quads, her glutes in that position. So if I have to come and try to nudge Angela a little bit, she should feel like a plank. That's the purpose of the exercise. We can do these a little bit lazy, like if you just let go of all that kind of tension, and I come and push Angela around, she can, yeah, move around like that. So we want to think of a plank, right? Again, this is a position the core is going to have to do its thing. What we don't want to do is we don't want to go the kind of easier it is relatively. It's hard exercise regardless, but relatively. The more narrow you go, the harder it is. So you'll generally start just outside a hip width apart. And again, all the same positions apply, except this time Angie's going to touch one hand to the other shoulder for a good solid second. Like you're going to properly pause there. So again, that's it, she is. Yeah, look.
Let's say something, Angie.
Oh, absolutely. So this is progression 3. It's a hard progression. Right, so you might not be there today, probably, you know, some of you probably won't, and that's fine. The goal is that you work to it.
Easy way to do that.
You'll keep working on your planks, ultimately, yeah. But you can always do them as just like little sets. Like sometimes we get people and they say, down, rest, shake it off. And their goal is to build up the volume. Yeah, so you don't have to like, if you can't do sets of 10, you can literally start at sets of 1.
Okay, cool.
Yeah. All right, so I told you guys you're going to be working a bit. I really want more. Beautiful. Come back. Let's swap to the other side now. Nice. taller people, this is an exercise that you're going to struggle, your longer levers with these things, so it's harder on the core. On our side, nice and low, wherever that shoulder's comfortable, out in front, or as Lou has it, wherever you're comfortable. And if you want a pillow or something like that, there's a few mats and stuff around for your head. Sometimes your neck can get a bit tired holding it there. And what Lou's going to do is she's just going to pull her toes up here, like that. And we're going to start with these raises, and your leg eventually ends up like that. 2 is toes rotating up to the ceiling. What we want to do is keep our feet parallel outside. Okay? If you don't, again, it's usually because the toes have pointed up. Short lever plank, side plank, where the knee is on the ground there, and Lou's doing the exact same movement, but she's now holding her pelvis up in the air. And we're going to imagine like there was a spike right there, and I'm going to tell Lou, don't allow your hip to fall on that spike. Do everything you can to keep the hip high in the air. So now we're working the bottom. Obviously, that's stabilizing. The top, as much as it looks like the top should be the one burning the most, it's most likely the bottom one. It's holding your entire body weight. And then imagine there's a spike there and working on that control. Okay, you're not going to likely, this is a real tough one. So you'll just get where you get to. Pause, pause, pause. Good, and down. Good. So that definite, like almost like longer than you want to kind of pause. Go. Last one. You feel that? Yeah, sometimes you've got to add more resistance to kind of get more muscle fibers to fire. You still feel that? You'll stay a bit more perpendicular to the ground. Yeah. And then you can go up. I'll suffer with you for a bit. That's it, dry. So what we're actually asking, while there is some glute involvement here, we're actually asking these erector muscles to work, just to hold that position. And then we'll come down and we'll swap to the other side. Now again, not many people get kind of the range that Ange gets there, so you might only find you get a little bit off the ground, which is perfectly fine. But what we want to feel here is we will feel glutes, but we also want to feel these guys. So we'll probably come around and poke around a little bit. We should really feel them working. Pads here, make sure you feel nice and sturdy through here. And we're going to hinge, and then we're going to come back up, and we're going to hold at the top for 1 to 2 seconds. So slowly back down. Pump one that we did at the beginning, you know, where we were kind of leg up and down. I know we've been through a lot, but if you remember that, far back, and back up. So there's no like cues on this one. It is really just bend down, get your hips down to the ground. We're not hinging, right? We're not bum back. We are allowing the spine to curve. If you can't get all the way down, all you do is you just grab like a plate or a little step. I'll just steal this here. And you can just go as low as you're comfortable going. So we might just start down there even, if you're a bit sensitive going down into the bent position like that. It might even be higher than that. You just start wherever you start is fine. Over time, your progression is to get down, reaching down to toes. It's not a flexibility thing. We're not like fussed on how low you go. It really is, just showing off. Yeah. It really is just that little bit of exposure, getting the back used to the motion. You'll find when you go chin to chest, especially for those who have like a bit of neural stuff, that you'll feel it. You'll feel almost mid-back wise. You might even feel a bit down the glutes. This is one of my drills that helped me the most. I mentioned before when I used to wake up in the morning, put my head down, I had so much nerve tension, it went all the way down. This is one Ange and I used for her back a little while ago as well. And then the last one is the chop and lift. So we'll go in this and rotate. And I want you to try accentuate the twisting component of it and the bending component. Just like that. Other things that we do, which are really important, are what we call carries. So there's lots of different variations of carries, but again, for our program, we're going to use what's called a farmer's carry. Very simple. You're going to grab some dumbbells or kettlebells, and you're just going to go for a walk. You'll see it in the description, but I do it from time, so like 30-second kind of carries. Suitcase carry, which is like a suitcase, one side. Really good one, because as you carry that weight, what does your core have to do? It has to kind of counterbalance you a little bit. And then the other one is what we call a front rack carry or a goblet carry. So you're going to hold some weight close to your chest, go for a walk. If you don't have weights at home or something like that, backpack with some water bottles or whatever you got is fine. It doesn't have to be an official gym weight to make them work. This kind of stuff is longer term. You work on this for a period of time. And this is where it kind of comes into the getting strong part. So when it comes to building strength, there's kind of 3 principles that you just got to follow, and they're very simple. The first principle is what's called progressive overload, which is slowly, over time, increasing the weights that you're using. right? So you might start doing some hinges with some weights, so like RDL, what's called RDLs or Romanian deadlifts. And you might start at 5 kilos, and then when that becomes easy and the back is happy with that, you might bump it up to 10 kilos, and you kind of are now in the forever strength building cycle. There's no end point until you pass away. So you're just basically going to get stronger and stronger for as long as you can. That's the end goal there. But progressive overload is one of those principles. You're going to start within your capacity, and over time, as you get more exposure to it, as you get better with the exercise itself, you'll build it up from there. Consistency is another big one. So everybody struggles with consistency. It's one of the biggest kind of struggles we hear about here, which is you're good for a few weeks and something in life happens and then all of a sudden game over again and you start it again when the back flares up again. But consistency is everything. And consistency does not mean that every session is 100%. Consistency is that if you start to do a program that's 3 days a week, you just do what you can 3 days a week. Some days you're going to have more energy and more time to commit to it, and you can push a bit harder. Some days, life's going to be a bit challenging. You're not going to have time and energy, but you're going to do something. That's consistency. Even if you rock up and you just did like the warm-up part of the program on a crappy day or a hard day, that's consistency. Not every session needs to be always up there. You just got to make sure that if it's 3 days a week, at some point in that 3 days, you've done something. And then the other thing is patience. Your progression isn't linear. It's not like you get better, 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 better. You generally do start and you make what's called beginner's gains, so you normally kind of do make progressions pretty easily, but at some point it's a very slow progression. It takes time, and if you talk to Ange or to Lou, I know for Dan, Ash, people who've been training for a long time, you get to points where it just feels like you're going through the motion, and that's part of the game. As long as you're being consistent with it and you're just playing the long game is kind of the key there. So then the program itself, I'm going to show you kind of a brief here. It's very simple. I'll try to keep it as simple as possible, and you can always come to me with questions or anything. Just email me or message me on Instagram if you're on there. But I've broken it down like this. There's an A day and a B day, and you're just going to alternate those days. You can do it 2 or 3 days a week, so you could kind of do a Monday A day, Wednesday B day, Friday A day, and then in week 2 you're kind of just alternating. Or you could just cut out the 3rd day and you just do A day, B day once a week basically. Whatever's going to work for you, I'm perfectly happy with. We generally want at least 2 days a week though. Each day is broken down into the exact same thing. You're going to have warm-up exercises, followed by activation and patterning exercises, followed by either a hinge or a squat exercise, followed by either a push or a pull exercise, followed by a core exercise or 2, and then some of the stretching. So they all follow the same thing. Rough estimates on times, really, I'd say initially it might take you 45 to 60 minutes, depending just how you kind of go, but you'll be able to really refine it to probably 35 to 45 minutes over time as you kind of just get into the rhythm of it all. Start on level 1, regardless of your experience, regardless of where you are. Make sure you tick level 1 first, which is very simple. It's not what you're seeing, it's a bit different as I've edited it. But the first progression might be just 3 sets of 10 to 20 glute bridges. Do that a few times. Make sure the back is okay with it. Make sure you can do the volume. Make sure that the back tolerates it and recovers well. Once you've done that a few times, say over that month, and it's good, you'll then go to level 2. Again, it's not right, but level 2 is, I think, working on the one-legged version. Then you work on that for the reps and sets in the program until you nail it, and then you feel like back is good with it and you built that strength. And guess what? You're going to go to level 3 and so on. You will get to a point though, and do that for 4 to 6 weeks or longer if you need to. Work on it until you hit kind of those numbers and standards, and then you'll go, maybe to the next one. But they're a little bit more in line with what you want to do. So you kind of get to choose your journey, so to speak, on that front. So that's kind of how that works through there. Right, and you wake up and you can begin the next day. So those are signs of improvement along the way. So don't feel like if you have a flare-up or you just have a bad period of back pain, it might not be a true flare-up, that you're not making progress. Yes, as long as you get back on the track, as long as you keep moving forward, that is the main thing, because you will see things change with time. It doesn't happen overnight. Right. One of the challenges, obviously, with all this stuff is kind of the accountability and the coaching and things along those lines. So So one of the things that we do, this is kind of part of it, which is the Back to Your Best Rehab program, which is a program where we kind of write your program for you. You get to come train with Lou and Ange in our gym, and part of that is you kind of get your treatments and everything's kind of inclusive. So we really are kind of create the whole environment for you. So you get to train here, have all the support, have myself and Ange and Lou to make sure you're forming your technique and progressions, everything which is right. We do testing, all that kind of stuff. If anyone's got back pain and wanting to return to running, we do field sessions where we teach you how to return to running for bike issues as well. But outside of that, you've got the program, and you can reach out to me obviously with that as well.